talked about anxiety, and let's talk about folks have sort of turned to various things during this pandemic. Let's talk about addictions.
Okay.
Let's talk about when somebody is having a difficult time ceasing maybe a certain activity that they don't find super constructive in their lives.
Yeah.
Whatever it is.
Yeah.
Whatever it is.
Could be a lot of things.
It could be lots of things.
Yeah.
What is addiction, and when is it clinically relevant to maybe talk with your doctor or seek some guidance?
Okay.
Yeah.
That's a good question. It's in some ways it's difficult to define, but
It's pretty broad, but
yeah, it can be broad. I mean, I was thinking about this before I came in. I heard, I go to a conference every year called the School of Addictions, and one of the speakers referred to addiction as, and I'm trying to remember exactly how he put it, but a problem with willpower. Basically, you don't have willpower. Because when it's become addiction, you no longer have control. And so like in AA, what they talk about is that you've become powerless. And so part of their solution is to accept your powerlessness, to admit to it, and to surrender it. And I think that's a great way to look at addiction. And maybe just by that itself doesn't explain enough, but it's a good place to start. And I think that when you've got an addiction, and basically that when you've got an addiction, it's got control of your life. And so you're no longer making wise decisions, and you're doing self-destructive things.
it's creating a destructive path
Yes,
in
yes.
various avenues in your
Yes.
life. Is that?
So if you find yourself in a certain activity, and especially, I mean, most people will know that something's not right. But I think it's important that you be willing to ask yourself. And I'm not here to say that everybody's got an addiction, or
Yeah.
I'm not here
right.
to point to any one person.
Well, we're all addicted to oxygen, right? We're all addicted to, but, and it was different. But,
Yeah.
I want to talk about
Well, like eating, for example.
overeating,
Yeah,
eating.
we got to eat.
Sure.
But yeah, we can become addicted to foods.
But when is it to the point where it is constructive, destructive to a human?
Well,
to
okay.
a person?
Well,
Yeah.
again, I'm going to repeat myself, but when you no longer have control,
Okay. Yeah.
and you find yourself doing it when you don't want to,
Okay.
like drinking,
good-
for example. So if you can't just take one drink, then you got to ask yourself, okay, is this problematic? I mean, it doesn't mean you're an alcoholic, but is this problematic?
Right.
And so do I need help? And I think that's what the people in AA will tell you,
Okay.
is that you need help. And that's not a judgment call,
Yeah.
because, they don't want to judge you. But they recognize that getting help sometimes is the way. It's kind of like when you're depressed and you're having a hard time getting out of your head,
Yeah.
by having someone that you trust to give you some feedback. Because in that depressed state, your judgment's not the best.
Absolutely
You're clouded because it's more negative than.
So again, if you are questioning whether you may have an addiction that's destructive to your life, seeking professional guidance, seeking mental health professional guidance,
Absolutely.
at least
Yeah.
to assess and see, okay, well, maybe this is something we should address or
Yeah,
not.
yeah. And I could go over the diagnostic criteria for addictions, but most of it has to do with the fact that it has become out of control, and you're doing more of it than you want to, and you're getting in trouble.
Okay.
It's causing problems in your life, it's causing problems in relationships,
Yeah.
problems on the job,
Right.
so forth. And people use the term functional addict a lot. You
Yeah,
know?
I've heard that, sure.
Yeah, and so to me, it's kind of like they're soft pedaling it a bit,
Okay.
you know? And really, when you have an addiction, it's very important that you come to the conclusion that you got to do what you got to do, and you're gonna recover when you accept that you need help, and that you're willing to do whatever it takes.
So you have to be willing and aware.
I think so.
Okay.
You know, and
Yeah.
and of course, a lot of times what goes along with addiction is shame. You know, almost always. And in fact, that's a lot of the problem, is that people have a notion that maybe I have an addiction, but they feel guilty about it, or they think that means that they're weak or something like that.
Sort of like the depression
Yeah,
you mentioned previously.
yeah, absolutely. And so when that happens, then the more you try to run from it or escape from it, the more power it gets. And so by surrendering, and what they do in AA, and it may seem paradoxical, as if that means that, you know, just don't try anymore. No. The thing about the AA model and the 12 steps is by letting go makes you more powerful than ever.
Wow.
You know,
Wow.
by accepting help makes you much better than you can be.
That's difficult to do.
It is. It
Accepting
is.
help, especially
so-
for a very individual.
Well, and that's our culture too, right? You know, the rugged individual. Like, you know, we praise people like Rambo and things like that. You
Yeah.
know?
It's
I've got-
sort of
I'm
a gender,
not-
gender thing we've
Well,
grown up with
that's
as
true.
well. Yeah.
That's true.
But yeah.
Yeah, that's true. So yeah, that can feed into it quite a bit. But again, to be able to ask yourself, well, what do I need?
Yeah.
And a willingness to look at yourself. Have you read Can't Hurt Me?
No,
Have you heard about it?
I don't believe so.
It's written by a guy by the name of David Goggins,
Okay.
and he's one of those ultra athletes who runs hundreds of miles.
Oh, wow.
Yeah,
That's awesome.
but he is a retired Navy SEAL.
All right.
But he talks about how he did it, and he came from a place where he was abused, and he's a black man who grew up poor and suffered lots of prejudice. But he turned all of that into a strength. And at one point in his life, he was 300 pounds, and he wanted to get into the Navy SEALs. And so in order for him to get accepted, he had to lose 106 pounds in 3 months. And he managed to do it. But he come to realize that he could do far more than he realized. All these limitations that people tell you you're not supposed to be able to do, he shattered all of them.
That's amazing.
Yeah. So it's a really good book, and I think that his perspective is worthwhile.
Okay.
Yeah.
Well, we'll have to let the viewers know about that.
Yeah.
That sounds amazing. I think I'd like to get my hands on that too.
Yeah. It's pretty intense book,
Yeah.
because he went through some incredible stuff. But to me, what I like about it is I don't assume that I'm going to be like him at all.
Yeah.
You know, nowhere near. But it gives me encouragement.
Absolutely. Well, as far as the addiction is concerned, I really never thought about seeking mental health professionals first. You always say, oh, you know, if I'm addicted to cigarettes, I'll take this gum, or I'll go to AA, or whatever it is. It could be a myriad of things. Just being aware,
Right.
and sort of creating some awareness.
And you know,
Yeah.
I think going to a general counselor, much like myself,
Yeah.
can be a good way to begin, because part of what we're trained to do is to do an assessment. And when you do an assessment, you're gathering a lot of information.
Yeah.
You're making a diagnosis, and then you're going to give recommendations. So it may be best that they see somebody else,
Sure.
or go to some other organization. So a good counselor should let you know when you should go someplace else.
That's great.
You know,
Great to know.
and like, because there are agencies that deal specifically with addiction, whether it's substance abuse, and there's even specific places that deal with eating disorders and gambling addictions and so forth. And so there's lots of specialty organizations out there, and so that's a good place to get started.
Well, thank you so much for being here, Corby. Thanks for being here with this mental health program, and we'll see you next time.